So I would like to introduce our next speaker, Professor Anil Pawani. He's a Vice Chair and Director of Pathology Informatics, Department of Pathology, The Ohio State University in the United States of America. And he's going to tell us today about the state of implementing AI-based histology diagnostics in pathology today. It is my great pleasure to introduce him today. So thank you very much, Dr. Pawani.
Hello, everyone. Can you hear me and see me? And you can see my screen?
Yes, thank you.
So first of all, I want to thank you for inviting me. I'm very excited about the Asian Society of Digital Pathology and the inaugural webinar. I'm a pathologist practicing in the United States, but I'm originally from Pakistan. So I'm excited that finally there is an Asian Society of Digital Pathology. So today I would like to share with you the state of implementing AI-based histology diagnosis and where are we in that. So I would like to provide you an overview of digital pathology and AI and its current state for clinical diagnostics, research, and education, and provide an understanding of the challenges and opportunities for implementing AI in the clinical areas, explore the future directions of AI in pathology diagnostics. So we are in a very exciting time because we can now produce high quality, diagnostic quality images routinely using multiple types of imaging devices, whole slide scanners. And in the future, these type of imaging modalities will continue to grow. So it's really exciting to see this happen. Today, we can see images which, for example, this is a patient with prostate cancer. With this resolution, you can see nucleoli within the nucleus. So this is the type of diagnostic quality images that is needed to make a diagnosis. And then finally, use these images in performing AI algorithms. So diagnostic quality images are a commodity now. So you can see throughout this webinar, you're going to see multiple talks from experts around Asia and beyond who will talk about using these images for AI. So what can we do when we go beyond the glass slide? We have opportunities to identify things, rare events, quantify them, and synthesize this information. This is a unique opportunity to perform. But the questions we have to ask ourselves throughout this webinar is, does AI really work? Are we there yet? Does it make our pathologists more accurate? Does it make pathologists faster? Does it really save us money? Because as you can see, by digitization, you are going to spend money as a lab, as an institute, as a pathologist. So routinely, where are we today, right? So pathologists perform multiple automated repetitive tasks. So we have an opportunity to automate these tasks, like biomarker quantification, looking for metastatic foci in lymph nodes, counting mitoses, grading tumor. What about primary diagnosis and cancer screening, right? So most of the algorithm work has been focused on prostate cancer and breast cancer, but these are examples of where AI can routinely be used for cancer screening. detecting cancer and grading cancer, predicting prognoses. So there is a whole new generation of imaging technologies like virtual staining, which will allow us to go beyond traditional whole slide imaging and produce high quality diagnostic images using computational pathology. So many of these are being used in several labs around the country, around the continent, and even in several countries in Asia. So this is an exciting time. So this is an example of a Key67 algorithm where you can see by pressing a button, I can routinely um, quantify how many cell count, what is the cell count, what is the nuclear count, how many Key67 nuclei are positive, what is the overall score in this slide. Something like this would take a long time to do individually by a pathologist and do it manually. So this is an opportunity to make pathology more objective, make pathology more accurate, make pathology more fast. So in this field of view, which is 2 millimeters square, you can see this is quantitation of nuclei, a biomarker. This could be any biomarker. But in this case, this is ER. You can see the area analyzed is 2 millimeter squares, and it took 28 seconds to do this. What about HER2/neu? So you can see HER2/neu in breast biopsies, less than 1 second. And there are opportunities to choose regions of interest, so-called hotspots, or even try to quantitate the entire image. What about cytology? This is an example of biomarker quantification in cytology. So on the left-hand side, you have a panel where you can select which algorithm to choose from, press a button, and the computer will start processing the image and providing you the quantitation. So automated biomarker analysis for clinical diagnostics allows you to focus on regions of interest and score them, provide objective answers every time. Like in this case, there are 36 3+ nuclei, as you can see in this highlighted region. So what about other areas, tasks that take a long time for pathologists to do, like screening lymph nodes and looking for metastatic foci? So this is an example of an AI app which is launched. It allows you to screen a lymph node that a pathologist would normally routinely review on their own. In this case, the AI has highlighted the cancer and identified areas of interest, like in this case, a rare focus of isolated tumor cells, which you can see here. So this is really has a potential to save time and also potentially increase the quality of your diagnoses. So as a pathologist, I'm excited to have access to these type of tools now, which I never did have before. So what are some of the false positives which can be which can cause problems for AI algorithms? So in this case, in this study that we did, you can see histiocytes were problematic, crushed materials were problematic, germinal centers were problematic. So blood vessels, like you can see here, were problematic. What about lymphocyte aggregates, nerves, and even contaminated epithelium? But as these systems mature, as these algorithms mature, they're getting better. They're getting more accurate, less false positives, less false negatives. Other areas in surgical pathology is cancer screening, which we routinely do. Today, we have several algorithms that are available commercially or even built by computational pathologists as an aid for surgical pathology diagnoses. So prostate cancer is one of a most frequently built algorithm. Many companies have worked on it. And in the United States, there is one algorithm which is approved by the FDA. And for the first time, there is a billing code now available for prostate cancer or for AI-based algorithm, which is still a non, it's a code which is for research use only. You do not generate revenue from that code, but I expect in the future, these codes will allow us to generate revenue, bill the patients for this AI-based work. So this is an example of a prostate cancer screening tool, which is called INIFY. So what does AI-based diagnosis do for prostate cancer or for any other cancer? It can be used in the pre-sign-out state. It can be used during sign-out, or it can be used post-sign-out. In the pre-sign-out stage, it can be used as a screening tool where you can find areas of cancer and quantitate it and grade it. It can be used in real time as a digital assist or tool, primary diagnosis without supervision or with supervision, and results could be automatically dropped into your electronic medical record. As a post-signer tool, it would allow you to look at the cases that you sign out and make sure there were no errors made. So it really improves the quality of your diagnosis. And also you can apply predictive risk stratification tools on top of that to allow for this. So this is an example of the FDA-approved Page Prostate Detects tool, where the computer is detecting it. You have a work list of cases, and the computer has identified the regions of which cases which are positive or negative or suspicious. And you can flag those cases, pull them up on this monitor, and start reviewing them. Most of these algorithms create heat maps, which can be turned on and off for sign out. For example, in this case, you can see here the computer is, you can turn it on and turn it off. This is an example of a prostate cancer with perineural invasion. And again, the AI tool can help identify this. This is an example of a patient with breast cancer, and AI tool has identified the cancer and created heat maps. In this study, we found AI identified a intraductal carcinoma that was missed on the microscope by the pathologist. What about looking for invasive ductal carcinoma? What about microcalcifications? So all these are examples of routine algorithms that are starting to make their way into the pathologist toolkit for the future. So this is a H&E slide. Here you can see the red areas are invasive cancer. And you can go and highlight that area, look at it in greater detail, and you can see the red area is indeed cancer. So what this heat map shows you the highest probability of cancer in that region of interest. So this is really, really exciting to see. Here you can see intralobular cancer, invasive lobular cancer versus invasive ductal cancer can be distinguished with the red versus blue. What about counting mitosis? This is an algorithm which is automatically looking for mitosis in a field of interest, tagging those mitoses, identifying, highlighting them, and quantitating them. So this type of tools are making their way to the pathologist. And again, not all labs have all the algorithms, but it's a journey where some labs have already started to experiment with them. What about other areas where surgical pathology or even pathology can be benefited by AI? So we routinely scan slides now and index them and label them and annotate them. But what about searching for images which are already in the database, looking for similar cases? So in this case, the query image is a subependymoma, and the AI algorithm successfully identified a similar tumor. this is a study we did where the input image was a renal cell carcinoma, and we asked the computer to identify similar clear cell carcinomas or chromophobe carcinomas or papillary renal cell carcinomas. So you can see these type of algorithms will be very, very useful for education, for research, and even for clinical diagnostics, where you might find an area um, that you want to quantitate, you want to classify treatment changes, you want to identify how much of the patient's tissue and tumor was benefited by the treatment, how much was it necrotic, and so on. So it's interesting to me that we are talking about AI and artificial intelligence versus real intelligence. Artificial intelligence is task oriented, and you're talking about a single algorithm per task. For example, the things that I showed you, biomarker quantification, lymph node mets, mitosis count, tumor grading, or real intelligence, which is experience-based, knowledge-based, integration of multiple types of data, not just image-based data, and it's context-based. So with experience, the human brain can be far more superior to this. But today we can outsource some of those tasks to AI. So this is an example of a case of patient who had two biopsy cores. One of them showed prostate cancer. The other one also was signed out as prostate cancer. I signed this case out. I called both of these prostate cancer. But when I looked at this one, I thought maybe this looks like colon cancer or rectal cancer. So I went back into the patient's chart. I reviewed it, and there was a history of rectal bleeding, and the patient refused endoscopy because it was very expensive for them. So I went back, I used my human intelligence to perform immunostains, and I was able to change the diagnosis. I was able to amend the report. So with one prostate biopsy set, I was able to detect prostate cancer and colon cancer in the same patient. Again, this is the difference between artificial intelligence and human intelligence. So at the end of the day, as we listen to these talks by experts, we should always bear in mind that ultimately it's the human pathologist who is responsible for the diagnosis, who has to oversee the process, who has to endorse the process, and ultimately make the diagnosis. So with this, I want to thank you all. So I think you're going to see very exciting talks on AI-powered pathology. It's maturing rapidly. It's connecting pathologists, increasing the access to pathology image data from institutes. It's allowing us to integrate AI models and learn from them and build them and be part of this evolution. And really, it's a transformative time for pathology. So I want to stop here and thank you for listening to me, and I look forward to the webinar and the panel discussions which will follow. Thank you so much.
Thank you very much, Prof. Pawani, and really, really appreciate Prof. Pawani for joining us, because it is currently at 1:30 a.m. in Ohio in United States. So thank you very much for staying up so late for us to actually benefit from our deep insights on AI and its utility, and its current utility in histopathology. Thank you.